Good morning, everyone. Welcome to another episode of Tooth Teacher Tuesday, specifically another entry in our Oral Pathology Corner series. Jumping right in to today's topic, we're going to be talking about different kinds of common sores that can occur in the mouth. Most, if not all of these, most of us can relate to. So starting off, the first type of sore is a canker sore or an aphthous ulcer. These are ones that probably pretty much all of us have had at some point, but they're usually just a single little ulcer that has a very characteristic look. I'll show you a picture here in a second. Usually kind of a whitish yellowish circle with a very sharp distinct red outline around it. And for how small they are, they usually have a disproportionate amount of pain. They usually hurt really bad. In fact, I've seen patients that have come in thinking they had a toothache when in fact it was just a little ulcer that they didn't even know they had kind of tucked away under their tongue or cheek or something. So they kind of look a little something like this. And as far as what causes them, research is, different causes are proposed, but most research links them to being stress related. But there are other things such as diet or genetics that come into play as well. But they usually only occur one at a time. Every once in a while somebody will have two or three that happen, but it's usually just that one distinct ulcer, and then these are something that'll heal pretty much on their own after a couple weeks. Main treatment is just managing that sharp pain until it feels better, so a little Oragel or Tylenol or something like that helps. But another very common type of sore is a cold sore, also known as herpes, which again, very common. In fact, I think it's important to address the fact that there's a certain stigma about herpes that is related to being kind of not shall we say, careful in your private life. But the reality is it's not just an STD, and in fact the majority of the population actually has herpes, and most of us don't even realize it. It typically lies dormant and may or may not ever have a sore in your life, but the virus is still in your system. And so I think it's important to note that there shouldn't be as much of a stigma about herpes, since most of us are carriers of it. But anyway, herpes, again, very common presentation for these sores is kind of an ulcer, but a lot of times they'll start out as more of a rash, sometimes on the lips or other parts of the face, or sometimes inside the mouth as well. But they'll usually start out, compared to a canker sore that's usually just one circle, usually start out as several tiny little blisters, kind of like this. And then as those blisters burst, they kind of become that ulcer that's kind of more crusty. Sometimes these don't even hurt as compared to a canker sore, but they are certainly contagious, so you have to be careful. Treatment for these is an antiviral medication if it's bad enough. Sometimes if you feel a cold sore coming on, you can actually prevent it by using some beforehand, but otherwise, yeah, just again, very common to get these. These can occur in multiple places at once, so again, kind of different from a canker sore, but and they can occur pretty much anywhere in the mouth, whereas a canker sore is usually more common either on the cheeks or the tongue. Herpes can occur anywhere in the mouth, whether it's the gums, the roof of the mouth, again, cheeks, gums, lips, so definitely more of an issue there. But then the final type of sore that's relatively common, again, I think most of us can relate to, is some sort of traumatic ulcer, which would be, you know, we've all been there where you've accidentally bit your cheek or your tongue or your lip or burned your mouth on some hot pizza or hot coffee. These again are going to look kind of like a canker sore. You're going to have that single circular ulcer there, but not quite as distinct of a red outline, and these are usually going to occur somewhere that's prone to trauma, like, again, the cheeks, side of the tongue, lips, roof of the mouth. But again, they kind of look more like this. And you'll notice there's not as much of that distinct red outline, but again, just like the canker sores or like the herpes, these do heal themselves after a while. They just kind of hurt in the meantime. But the final thing I'll say about that is, as you might have noticed, common thing with all these sores is that they all typically heal on their own. The rule I have for all my patients is if they have any kind of sore in their mouth, doesn't matter where it is, if they've had them in the past or not, if you notice a sore in your mouth, that should typically heal on its own after 2 weeks. The 2-week rule is what I go by. Any sore in the mouth that hasn't healed after 2 weeks is something a little bit more suspicious, that it may be something to worry about not healing on its own. You know, certainly one main concern would be that it's some sort of oral cancer, but there are plenty of other things that wouldn't heal on their own that quickly that would be reason for concern as well. So that's a couple of common oral ulcers that, again, most of us have probably experienced these, but yeah, I hope this has given you a little bit more information about the differences. And certainly, as always, if you have a sore in your mouth, please consult your dentist. Don't try to self-diagnose based off of this video. And again, if it's not healing on its own, even more reason to have a dentist check things out. So take care, everybody. Hope you have a great week, and we'll see you on the next Tooth Teacher Tuesday.